Welcome to Prescription for Change, Self-Care for Doctors. Now I know you guys know this story well. You have a full panel of patients for the day. You have 20 charts from yesterday that you didn't get done. You've got 10 labs to review and at least 4 phone calls to make. And then your first patient walks in 15 minutes late. You know the rest of your day is just gonna go downhill from here, right? And our tendency is just to keep going. I mean, med school teaches us just to plow through, right? No food, no sleep, no concept of self-care, all in service of our patients. But if you think of your energy as water in a pitcher, you can pour and pour and pour and pour and pour, but eventually you run dry. And then what happens? Everybody suffers. Your patients suffer, your spouse probably suffers, and you definitely suffer. You wind up depleted, exhausted, resentful, and then it takes you hours to replenish that energy back up again just to do it all over again. But what if I told you that there was a better way? That you could replenish yourself throughout the day so that you never actually got to full tilt? What if I told you that you could effectively decompress yourself so that you could enjoy life on a more consistent basis? Not just when you're on vacation, getting away from it all, but dare I say on a monthly, weekly, if not daily basis. The skill I want to teach you guys is self-care. And doctors usually have a hard time with this concept of self-care and self-nurturance, but it is the concept that we deserve the same level of care, if not more, than the level that we provide for our patients. That we need to protect ourselves and we need to nurture ourselves to the maximum to be able to do what we do. So, resting, both physically and mentally, recharging, both emotionally and spiritually, and nourishing our mind and body are all important self-care items that we really do need and deserve. So physically, let's make sure our bodies are right. We all know how important proper rest and nutrition is for our health. We preach it every day to our patients. And yet, how many of us eat our lunch at our desks while doing charts in about 10 minutes? Not only does this cause heartburn and indigestion, but it deprives us of a break from the day, which then means we're more exhausted at the end of the day, which probably means we didn't get those 20 charts done, which definitely means they're going to be waiting for us in the morning. And around we go. Emotionally, have an outlet to vent about your frustrations for the day, as well as your frustrations for your life. We're not robots that are immune to depression or anxiety, sadness, or burnout. Pretending like we are is only going to set up impossible expectations that we cannot meet. And when we fail them, because we will, we tend to judge ourselves as the failures when in fact it was this impossible ideal of what a physician should be able to do that's faulty. We preach to our patients all the time to tend to their mental health. Why do we ignore our own? Hire a coach, talk to a therapist, talk to your pastor, journal. Get it out before it eats you up. Spiritually, tend to your soul. Remember when we were young and just had fun and enjoyed the simple things in life? That sense of joy, light, and wonder is a really strong force that can buoy you when the weights of your practice are crashing down. So what brings you that sense of joy and peace? Maybe it's going to church, painting, reading, taking a long walk with your partner. Remember that there is a world outside of your office and you are meant to participate in it. We are not automatons that deserve no rest and no pleasure in life. We work so hard. We deserve to play hard too. In addition to building these types of self-care routines outside of the office, we also need to be able to take care of yourself during the 8 or 12 or 16 hours that we are at the office. So the idea here is to do something small throughout the day that you can use to treat yourself or to calm yourself. Again, doing anything is better than nothing, right? So here's a list of a few suggestions. Every hour, set an alarm to just remind yourself to take a deep breath. Put an infuser in your office to make the room a pleasure to be in. I love me some cucumber melon, and it is so nice every time I walk into my office and smell it. Put a picture or a memento of something calming directly in your line of sight so you can see it all day long. I taped a small little memento that my grandma gave me literally to the screen of my computer, so it's always in front of me. I love my grandma, and seeing it makes me feel loved. Put something in your pocket that you can physically touch that means something to you throughout the day. Okay, so those are some ideas. Now, what's one thing that you can do to take care of yourself throughout your day? I know what you're going to say. You don't have time for any of this. But let me ask you this. How much time do you spend now complaining about how tired and frustrated you are? How many hours do you need to decompress from your day? What would you rather be doing with that time? By using the techniques I've shown you here, I can guarantee you that your day will go by better, smoother, and faster. But again, these are just some simple tips that are the beginnings of a more in-depth conversation. A full course on this topic would really include delineating each and every specific pain point you have throughout your day, and then creating workarounds and methods to address each one. We would also do some work on exploring your limiting beliefs about self-care and seeing if they're really helping or harming you at this point. For more information about a full course, please check out my website, guidingclarity.com.